Good morning, YouTube. Good evening, good morning. Out in YouTube land, it's another video in the series on degenerative disc disease, back pain, really pain in general. I'm going to talk about pain meds today on this video, narcotics, which can include oxycodone, hydrocodone, let's see, Lortabs, all the generics thereof, Percocet, which is the oxycodone series. They're basically the narcotics that are made to take away the pain, to alleviate the pain. In my case, it's from degenerative disc disease, bulging disc, herniated disc, osteophytes, arthritis. If you want a little background on me, you can watch some of my other videos, the ones that have to do with my back problem. But I want to talk to you about narcotics today, and the pain meds, and I want to talk to you about in this way. I'm not a purist from the perspective of I'm going to tell you not to take them. If you need them, there's some of you out there that have back pain, and there's lots of other pain, but I'm talking about spinal problems, and that's the only way. With the narcotics, that's the only way you can alleviate that pain. And I'm with you. I get that. I totally get that. So there's some, well, I don't believe in pain medication. Well, you might not live with chronic pain every day of your life. Okay, so you can just check out now, and I'll see you. Thank you for watching. Have a good day. But that being said, I want to talk to you about some of the dangers of it and the negative side effects. And what happens when we're on narcotics, pain medication, for a long period of time. Our pain tolerance threshold goes down. Okay. So what happens is, your back pain is, say, at this level, whatever the pain may be. So, and you learn to tolerate a certain pain level. When you take narcotics, it takes your pain level from here down to here. Okay, even sometimes almost non-existent. So what happens is your tolerance for pain is decreased. Okay. So then when you try to come off of them, the pain that you're actually feeling, when you're trying to come off of them, is actually magnified, and it makes it feel worse than it actually is, because your body has become dependent on that drug just to function. So your body learns very, very quickly that it doesn't have to function without it. It's similar, like, for example, a person that lives in a cold climate, let's say a person from New York State, okay, and it gets down to 40 degrees, they're probably standing there, they can go outside in a short sleeve shirt with very little trouble and hardly not be cold. And I'm being very general here. Maybe not every single person is the same way, but yet a person that's from Florida goes up to New York in the fall, say October, November, when it's starting to cool off, They're standing there in a big winter coat with a scarf on and gloves in 40 degrees because they have no tolerance for that. Okay, your pain threshold is the same way when you're on narcotics. So in effect, yes, I understand that these things are helping you, but I want to caution you and tell you that I think in some cases they're actually hindering your recovery. In some ways, you may not be in as bad of shape as you think you are. Let's say you're starting to get better and your pain is not quite as bad as what it was. You try to go off the pain meds, the pain spikes. Because you're so dependent on that narcotic. Okay, so what I'm trying to do, and I'm going to talk to you about in another video, is maybe look at alternative methods to alleviate some of the pain, or even maybe suck it up a little bit if you can, and try to build your pain threshold back up a little bit. Okay, slowly over time. I'm not telling any of you to suffer, but I want to caution you about the dangers of the narcotics because there's a lot of side effects, and I'm going to tell you about some of them that I've learned about through some personal study. One of them, these things just tear up your organs. Okay, let me just tell you this. There is no drug that you can take that is healthy for your system. None. No street drug, no pharmaceuticals. All of them things are extremely damaging. Even steroids, prednisone. Some of you have been helped by prednisone. I'm not one of them. I do not respond positively to steroids. It's been tried. Very, very early on, it done nothing for me. Some of you might consider trying that for DDD. Some people respond to steroids good, but that's another video. But that stuff is extremely damaging to your organs. The other thing that happens with narcotics is moodiness. And like if you're a parent or you're married or something, if when you pop one of these narcotics, all of a sudden you get in a good mood. 4 or 5 hours later, whatever the case may be, the level of it starts to decrease. You get grumpy. And just try it. Think about it. If you've gotten grumpy with your kids or with your wife, husband, etc., just think about and try to notice if it's maybe at a time when your medication, after, if it's several hours after, just kind of start to think about it. See, because these narcotics, not only do they kill physical pain, but they also mess with your mood as well. They also mess with your fatigue. A lot of times you take one of these things and your energy level will spike, but it'll crash a few hours later. You'll start to get really tired. So what I'm saying is this: I'm not against the use of them, because I know that there are, if you need them, you need them. But I want to caution you on staying on them too long, and to start to try to have a plan to start to come off of them. And I'm going to talk to you about that in another video, because I've got some plans for myself. Some of us, may be dealing with a severe back problem for a long time, an extended period of time. And to think of staying on pain meds for 10, 15, 20 years, that's a grim proposition. You don't want to do that to your body, because here's what's going to possibly happen. it's going to cause you other health problems. So now you're not only going to have a back problem, knee problem, hip problem, shoulder problem, etc., etc., etc. But now you're going to start to have other organs break down, which is going to cause other disease, which is going to bring further medical problems into your life, which is going to be further expense, further depression, further disability, and then see this stuff just compiles. Okay, and I want to kind of warn you against that and tell you that I would recommend trying to avoid these pain meds all you can. If you're not on them now and you can find other ways to alleviate your pain, I definitely recommend that. And if you are on them, try to avoid increasing the dosage as long as you can. And also, if you've been on them a while, maybe try to think about starting to decrease your dosage and start to wean yourself off of them. Please, please, please do not, if you're taking 3 or 4 a day or more, don't watch this video and stop taking them. Please, please, please do not do that. That can be extremely dangerous. If you do have a desire to come off of them, you need to call your doctor. And presumably you've got a doctor that's pretty good. Call your doctor, make an appointment, and go in and talk to him and tell him, you know, you're concerned and you would like to come off of them, and ask him to help you out with a plan. Maybe if you're taking 4 or 5 a day, maybe you can decrease that down to say 3 to 4 a day for a couple of weeks, because you can have all kinds of if you just stop taking them, you can throw your body into a shock, and there's other things that can happen with your psychology and so forth. So, and that's something you might want to talk to your doctor about. Say, look, you know, what are the chances of me getting off of these things, or at least trying to come off of them? And so that's what I wanted to talk to you about today. I hope you have a blessed day. I'm off to therapy, and I'm gonna maybe make another video about some alternative pain management that avoids the narcotics, because they work. I mean, you guys know that they're very effective. And one thing about drugs that I've known through a lifelong study is any drug that's that effective, there's always a negative side effect to it. Always, always, always. That's just the way it is. So I'll talk to you guys later. Have a great day.